dangerously dumb legal tactics on Philhealth upcasing that you must avoid. Hospitals and doctors get their Philhealth accreditation suspended due to upcasing. The reason? Many have dangerously dumb legal tactics. Yes, you heard me. Dumb. First, what is upcasing? Upcasing or upcoding happens when the current benign low-rate diagnosis of a patient is changed into a false, complicated, high-payment diagnosis. There is only one intention. This is to make money. However, at times, this is unintentional. Okay, you have some clerical error, okay, honest mistake. But at times, it is intentional, a mechanized money-making scheme. Now, the bad news is, Philhealth does not care. If your doctor is spoiled and entitled, he starts to cry and roll down, and they call a friend, they call the mayor, the governor, or the senator for divine intervention. Again, the bad news, Philhealth does not care. It's very simple. Upcasing is a fraudulent act. This is a violation of Philhealth rules. Now, to be fair, your violation will be afforded due process. Now, 4,000 pesos can easily be a 15 peso payment with a small stroke of a pen. Tempting, right? This is one of the most common upcasing cases. Now, the patient has lower respiratory tract infection or LRTI. The signs and the symptoms and the clinical management are benign. Philhealth will pay 4,000 for LRTI. But when the doctor changes it to a community-acquired pneumonia, moderate risk, the CAP-MR is 15,000. Just a small stroke of the pen, and you will have a bigger payment, even though your claim is inconsistent and incorrect. Now, common upcased illnesses, you have sepsis, AGE, no dehydration, and you also have community-acquired pneumonia, high risk, even suturing is common, and many more. So, what is the flow? Now, when Philhealth files a legal case against hospitals and doctors, they will receive an affidavit complaint. Philhealth lists the alleged violation and explains the legal basis. The hospital or the doctor is required to submit a verified answer. Now, this is the reply to the complaint. The reply must be a clinical justification or explanation of the alleged upcasing violation. Now, this is important. The future of your upcasing legal problem will depend on how good your clinical justification is. Sadly, many end up suspended because their justification is garbage. There are 3 dangerously dumb tactics that will surely fail. Your accreditation will be suspended if you do this. Now, I will save the dumbest tactic for last. First, I call this doctor na, lawyer pa syndrome. Let us say, you are a doctor, you are a good specialist, you can be a surgeon, you can be the cardiologist, pulmonologist, you can be a general IM, family medicine, or pediatrician. You're the expert in your field. Then you receive an affidavit complaint from Philhealth. The complaint highlights upcasing of diagnoses. Your violation is misrepresentation of false information. So you are asked to reply in 10 days. Your arrogant hormones comes in. You felt insulted, confused, and fuming with anger. Now, because you are a brilliant doctor in the hospital, suddenly you decide to make a legal reply on your own. You become a lawyer overnight. You feel your legal opinion or jurisprudence is more than enough to counter Philhealth's legal complaint. Boom! The doctor is now a lawyer. The doctor na lawyer syndrome. You are the doctor and the lawyer in one. Now, unfortunately, most of the time, this will not work. First, your overconfidence is a little bit misplaced. Even if the intention is pure, this is very risky. You are not trained for this. Take note, your legal case is not a mortality morbidity conference. This is not a review of a double-blind clinical study. It is not a clinico-pathologic conference. Your case is part of a quasi-judicial process. It has many moving parts. Now, I will give you an analogy. Let us say, you are the best golfer in the world. Because of your skills, you are confident that you can join, you can compete, and win the Formula 1 race. I have news for you. You will not win. It does not work that way. The same thing with your case. You're a doctor. You're not a lawyer. You're too confident or probably borderline delusional. I have seen this tactic many times in both hospitals and doctors. If you use this strategy with Philhealth, your accreditation may be suspended. So the best thing to do is hire a good lawyer. Which brings us to number 2. Okay? Clinical justification by lawyers is doomed. Do not ask, instruct, do not beg your lawyer to make a clinical justification on your case. Your lawyer is not trained to do that. Take note, the outcome of your upcasing case is dependent on your clinical justification. Philhealth wants you to explain how you were able to arrive at your diagnosis. It must be based on patient signs and symptoms, physical exam findings, laboratory or diagnostic results, medicines, and the entire clinical management. Then, relate it to the clinical practice guidelines. All are clinical. The upcasing issue is clinical in nature. Never ask a lawyer or a non-clinical person to justify a clinical issue. Even if the lawyer volunteers to make the clinical justification, do not do this. This is dumb and a dangerous strategy. Your lawyer did not do the rounds. Your lawyer did not do the surgery. Your lawyer has less competency in clinical matters. You're the doctor. You do the clinical justification. Now, the lawyer will guide you on the legal process. That's it. As a doctor, you make the clinical justification that is asked in the complaint. I have seen clinical justification made by lawyers. Well, there are good ones, but the majority is a disaster. The clinical justification consists of 90% about legal technicalities. They dissect the complaint and focus on how the law was interpreted. That's it. Then, 5% is clinical. They attempt to discuss the pathophysiology of the illness and management, but they fail to make it relevant. Then, 5% is garbage. They come up with explanations that are clearly out of this world. At times, it's embarrassing to read. So, your clinical justification is a make or break. Do not ask your lawyer to make a clinical justification. It is not their task in the first place. So, saving the dumbest strategy that hospitals and doctors do for last. Recycle of garbage justification. Many are suspended because of this. Now, Philhealth legal process has several stages. There is the fact-finding investigation stage. Then there is the prosecution, and there is the arbitration, and then the board. Okay? Your case must not be elevated to the next stage. That is your goal. Now, I hope you got that. Now, in every stage, the hospital and the doctor are informed about the alleged violation. In every stage, hospitals and doctors are asked to give a verified answer or a justification. Example, during the investigation stage, the hospital and the doctor are asked to make a clinical justification. If the investigators are not satisfied with the explanation, the case is elevated to the next stage. Now, this is the prosecution stage. The next stage, the prosecution office will do a preliminary investigation. An affidavit complaint will be sent to the hospital and the doctor. They are required to submit a verified answer once again. This is, again, a clinical justification. Now, if the prosecution is not satisfied, the case is elevated to the next stage. Now, the next stage is the arbitration. And another clinical justification is asked. Take note, in every stage, hospitals and doctors are asked to make a clinical justification. Each stage can decide whether to elevate your case to the next level. If the justification is not convincing, it is not valid, if it's not sensible, the case is always elevated to the next stage. The dumbest and most dangerous tactic hospitals and doctors do, when the clinical justification that they submitted to the first stage is not convincing, this means it's garbage. This is the problem. The hospital and the doctors, when asked to make another justification, they recycle the same justification and give it to the next stage. Naturally, the same justification is junked. The case is again elevated to the next stage. Then the doctor and the hospital recycles the same justification and submit it again. Then, to the next stage, again, repeating the same thing. They simply do not get it. When your case is elevated to the next stage, this means your clinical justification has less or has no value at all. It means at that specific stage, they read your verified answer or justification. They do not believe you. You failed because your clinical justification is garbage. Again, this is dumb. Most hospitals and doctors will submit the exact justification that they submitted years ago or months ago. Some of them will not edit or update the justification. Again, if your case is elevated to the next stage, it means your original justification was not accepted. You need to make a more credible, convincing, and truthful clinical justification. Your justification must align with clinical standards. Do not recycle the garbage. Many are suspended because they wasted the opportunity to defend themselves. Furnishing Philhealth with recycled garbage, clinical justification is dumb times 100. In another video, I will explain this dumbest tactic being practiced by Philhealth healthcare providers. You have a legal case. It is all in process. To avoid being suspended, you need to give a very good verified answer. You need to give a very good clinical justification on how you were able to arrive at your diagnosis. So 3 scenarios that you need to avoid. Avoid the doctor na lawyer pa syndrome. Seek help from a good lawyer. Next, never ask your lawyer to make a clinical justification. This will not work. A clinical justification must be made by a clinician. Lastly, do not be dumb. Never recycle a clinical justification that is garbage. It's already garbage. It has no value. My friends, this is Coach Doc Ben. See you in our next session.